the world. It's a huge area. She's been in Peterborough for a year now, and previously she'd worked in small communities and within First Nations communities. She worked with Toronto Public Health and did a fair bit of work on community right to know, I believe. So we're very, very happy to have her here today and to speak to us, and we're so glad that she could come and join us. Thank you.
Thank you, Marion. It was a pleasure listening to you. I certainly have learned a lot, so I'm glad to be here. And I was certainly sad to hear over the weekend that Stats Canada released some more bad news, that our unemployment rates are up. This isn't just bad luck for the individuals that have lost their source of income. This is bad news for all of us. The productivity and the economics of the community is the engine that drives the health of that community. In the bigger picture of health, it's the social determinants such as housing, education, income, gender, and race that have the biggest impact on the health of the population. Unemployment is bad for people's health. So is poverty. Health impacts of unemployment include depression, cardiovascular disease, substance use, and stress disorders. In 1997, and that's 12 years ago now, the National Forum on Health reported that the most important yet difficult issue for the health of Canadians is the availability of jobs. So besides efforts to develop our local economy so that people in Peterborough have work in Peterborough, I think it's important for all of us to advocate for better and timelier support for those who have lost their jobs. As you've already heard, the unemployment insurance system in Canada currently leaves many individuals and families out. I know I personally contribute to this social program. I've contributed to it all my working life. I hope I never have to use it, but I want it to be there for people who need it. I've signed the petition calling on the federal government to address the eligibility criteria, to extend benefits, and to eliminate the 2-week waiting period for EI, and I hope all of you have as well. Thank you very much to the organizers for making this issue, for bringing it alive and bringing it here to Peterborough. I certainly count on the work of social activists to make this a more just society for everyone so that we all enjoy better health. So good luck in this endeavor, and again, thank you so much for inviting me to be here.